Hello guys, welcome back to Medico Days. So I have compiled question number 1 to 70 in my previous two videos, and in this video I'll be doing the remaining 30 questions which will make a complete of first 100 question recall of Inicet May 2025. Since it was my duty day yesterday and today I was a bit late in uploading the recalls, and in this video I have uploaded it in both the patterns. So the last 30 questions, first I'll be discussing them with a small explanation, and if you are someone who is just looking for the answer with the question just in one line, then you can move on to the last part of this video where I'll be showing just the question with the answer. Initially I'll be discussing with the explanation, the brief explanation as well. So question number 1 of physiology, IGF-1 and 2 are structurally similar to. So answer is insulin. This was a question of doubt for many students, and multiple sources have been referred to find the correct answer to this question, and finally we found it to be insulin itself. And if you have any doubts, you can check with Ganong textbook where it has been clearly mentioned that it is insulin. So next question, which of the following is seen in high altitude? Answer is respiratory alkalosis. At high altitude, low oxygen triggers hyperventilation to compensate, and the hyperventilation causes excessive CO2 exhalation, leading to respiratory alkalosis. And next, surface tension of the fluid lining the alveoli increases during. Answer is inspiration. So during inspiration, alveolar expansion stretches the surfactant molecules, reduces their concentration at the air liquid interface, leading to increased surface tension. During expiration, the opposite happens and there will be reduced surface tension. Next, which effect is not seen after activation of Basal-Jarisch reflex? Answer is tachycardia, because in Basal-Jarisch reflex there will be bradycardia, hypotension and apnea. Next question, in a normal awake patient at rest with eye closed, which EEG waves are reduced upon opening the eyes? Answer is alpha waves. And please have an idea about the different waves. Beta waves increase with eye opening or alertness, and theta or delta waves, they are seen in sleep or pathology and not awake or rest. So please learn about the frequencies and in which conditions they are seen. And next question, calculate the tetanizing frequency if contraction period is 40 milliseconds. This you need to know the formula. Frequency is equal to 1000 by contraction period, and if you use this formula, then you will get the tetanizing frequency to be 25 Hz. Next question, patient presents with fever. Which hypothalamic area is involved? Answer is preoptic nucleus. Hypothalamic areas and their functions are very important. Please learn about them. So a brief explanation is provided here. Which of the following is not an action of ADH, that is antidiuretic hormone? Answer is decreases absorption of NaCl in thin ascending limb. So ADH does not directly modulate NaCl transport in the thin ascending limb. This segment, it passively reabsorbs the sodium chloride via countercurrent multiplication independent of ADH. Next question, where are tight junctions primarily located? So answer is apical. Tight junctions, which are also known as zonula occludens, they are located at the most apical part of the lateral membrane, forming the apical junctional complex with adherens junctions. Next question, which of the following is an example of a feed-forward mechanism? Answer is thermoregulation or exercise. It is also seen in baroreceptor reflex, cold-induced vasoconstriction, and compensatory CO release. Moving on to pharmacology questions. Regarding thalidomide, true statements are, so this is a multiple correct answer question, and the answers are teratogenic in pregnancy, role in refractory multiple myeloma, and useful in lepra reaction. So the wrong statement is anti-metabolite having immunosuppression action. So thalidomide is not an anti-metabolite. It works via immunomodulation. Next question. An 8-year-old girl taking carbamazepine 800 mg per day developed ataxia and balancing difficulties after starting erythromycin. Most likely causes, answer, carbamazepine toxicity. Erythromycin will inhibit the CYP3A4, the enzyme that metabolizes carbamazepine, leading to elevated carbamazepine levels and toxicity. And the symptoms of the toxicity include ataxia, dizziness, nystagmus, and drowsiness. Most appropriate treatment for patient with complicated UTI presenting with diabetes mellitus is meropenem, because septic shock in UTI requires broad spectrum IV antibiotics with rapid bactericidal activity and coverage for all the likely pathogens like E. coli, Klebsiella, Pseudomonas, etc. Meropenem is a carbapenem covering gram-negative, gram-positive and anaerobic bacteria. Which of the following treatments are appropriate for scabies in infants? Answer is 5% permethrin cream, and the next best option would be 10% crotameton cream. Next question, which of the following new psychoactive drugs works as a rapid acting antidepressant? Answer is ketamine. FDA approved esketamine nasal spray for treatment resistant latent depression, and it acts as an NMDA receptor antagonist, producing rapid antidepressant effects. It is used in clinical setting for acute suicidal ideation or severe depression. All of the following are clinical uses of magnesium sulfate except. Answer is improves renal blood flow. There is no direct effect on renal blood flow by magnesium sulfate. It is used for seizure prophylaxis in preeclampsia or eclampsia and neuroprotection in preterm labor to reduce the cerebral palsy risk, and also it reduces the placental abruption risk indirectly by stabilizing the BP and preventing seizures. Next question, what is the drug interaction between imipramine and diphenhydramine? Answer, both block the muscarinic receptors. So imipramine and diphenhydramine both have anticholinergic properties and they block the muscarinic receptors, and combined usage can lead to additive anticholinergic effects causing dry mouth, constipation, urinary retention and confusion. Next, gonadotropin releasing hormone antagonist uses include multiple correct answer question disease, and the answer is ovarian cyst, controlled ovarian stimulation, IVF and prostate cancer. Next question, which of the following anti-epileptic drugs is contraindicated in pregnancy? Answer is valproate because it is strictly contraindicated because of the risk of congenital malformations and neurodevelopmental disorders. Which of the following statement is incorrect? Answer is alcohol withdrawal is treatment with flumazenil because flumazenil is a benzodiazepine antagonist used for benzodiazepine overdose and not for alcohol withdrawal. Next question, which of the following are topical side effect of corticosteroid creams? It is a multiple correct answer question again, and answers are hyperkeratosis, atrophy and acne. Blue-grey skin thinning is not seen. Next question, which of the following factors are involved in calculating the loading dose of a drug? Again, multiple correct answer question. Answers are volume of distribution, target plasma concentration and systemic bioavailability. So the formula is also given here. Loading dose is equal to target plasma concentration into volume of distribution by bioavailability. Next, what is the mechanism of action of phenol-dopam? So it is a selective dopamine 1 receptor agonist. So selective D1 receptor agonist will cause vasodilation in the renal, coronary and peripheral arteries. It is used for hypertensive emergencies and to improve the renal blood flow. Next question, which of the following drugs are used in the treatment of malaria? Multiple correct answer question again. Artemisins, sulfadoxine, pyrimethamine and chloroquine. So brief explanation about each of these is also provided here, and about primaquine as well. What is the mechanism of action of bempedoic acid? Answer is it inhibits the ATP citrate lyase. First in class ACL inhibitor that targets the ATP citrate lyase, an enzyme upstream of Hmge CoA reductase in the cholesterol biosynthesis pathway, and it has dual mechanisms and also liver specific activation, which are mentioned little in detail here. Next question, match the following drugs with their correct drug schedules. Drug schedules, again a favorite question in INI and also important for Neetpg and Fmge as well. So schedule H drug is insulin, schedule Z goes for veterinary drugs, schedule X goes for morphine and schedule G goes for hepatitis B vaccine. And a brief explanation about each of these schedules are also provided here. Next, which of the following is the first line treatment for acute mania? Answer is lithium and valproate. Lithium is a gold standard for classic euphoric mania and valproate is preferred for mixed episodes or rapid cycling, and it has a faster onset than lithium. So surgery questions, which of the following is not included in stage 4B breast cancer? Answer is inflammatory breast cancer. Stage 4B breast cancer indicates distant metastasis to bone, lung, liver, etc. and it includes local skin features like ulceration, PUD orange and satellite nodules. Next question, a patient with confirmed breast cancer and family history involving two relatives has a 29-year-old daughter. Which gene should be tested first to assess the hereditary breast cancer risk in this patient? Answer is BRCA1. So BRCA1 is the highest priority gene for hereditary breast cancer testing. BRCA2 is also important, but it is second to BRCA1. It is more associated with ER plus breast cancer and male breast cancer. Next question, what type of surgical technique is a Z-plasty? Answer is transposition flap, which is provided, and Z-plasty involves transposing two triangular flaps to redistribute tension or alter scar orientation. Next, which statement about vacuum-assisted closure therapy is incorrect? So this is a doubtful question, and decreased bacterial load will be the most appropriate as far as we have inquired and found it out. And standard vacuum-assisted therapy uses 125 mmHg, not 10 to 15 mmHg, and the range is between 75 to 150, and it enhances also the granulation tissue formation and protein matrix synthesis, and negative pressure can be delivered continuously or intermittently. So that's it, guys, and proofreading is still going on for the recall questions of the version 1, and here I have provided as mentioned previously, I have provided the question with just the answer so that it will be easier for you to check if you have got correct answer and to find out your total number of correct responses. So that's it, guys. Hope it was a helpful video for you all. Until I come back with my new video, stay tuned. If anything is there, please don't forget to mention it in the comment box. Support my channel, do subscribe, share with your friends, and that's it. Till I come back with my new video, stay tuned. Bye bye.